Thank you for taking the time to view the COVID-19 vaccination rollout best practices for community health centers. This playbook was initially created in the spring of 2021 as a collaboration between the Massachusetts League of Community Health Centers, Blue Cross Blue Shield of Massachusetts, and Day Health Strategies. We're going to take just a few minutes to show you how to use this document, which is an interactive PDF. You are more than welcome to print it out, but it was intended to be clickable and viewed electronically. This playbook was originally structured to contain 7 sections that we call the 7 S's. These are strategy, startup resources, space, staffing, systems, supply, and spreading the word or communications. For each of these sections, you will find a few things. Some key considerations along the vaccine workflow from scheduling to follow-up, a master checklist of items to consider or do, and a series of tools and resources to help you work in this particular section. You can see here on the introduction page a clickable table of contents that will take you to each of these sections. Let's click on space as an example. So you can see here at the top the workflow from outreach through registration, check-in, vaccination, observation, and follow-up, and just a few key considerations for each of these areas specifically related to space. If you scroll down, you'll come to what we told you before, which is there's a master checklist, and each checklist goes through the planning, prepping, and performing stages. And again, this is specific to space. And so if there's a clinic space or a temporary space or a mobile space, you'll see different sections related to all those pieces. Finally, at the end, we have a series of tools and resources. If we scroll down to the very bottom, and you can click on these tools and resources and get to the items that are linked to these boxes here. So for example, we've got some CDC items, and there's some best practices features on specific health centers in Massachusetts, or actually in Connecticut in this case, related to the space category. All right, if we go back to the introduction page and our table of contents, below this initial list of 7 S's, we have 3 additional sections that were created to respond to emerging needs and trends in the COVID vaccination space. These are a detailed guide to using the Pfizer vaccine, which is of course critical for pediatric vaccination as of May of 2021. There's a section on partnerships, as most health centers partnered with various types of organizations to deliver vaccines and continue to develop new types of partnerships. And there's a third section to introduce point of care vaccination into clinics, which is what most organizations will be doing as we move away from mass vaccination clinics and sites and begin to incorporate COVID vaccination into the everyday clinic workflow. Let's click on Pfizer just to show you what this one looks like. Great, so for Pfizer specifically, we've demystified it by walking through the ordering, receiving, storing, distributing, thawing, reconstituting, administering, and of course, recovering and disposing process. Again, this looks a little bit like a checklist, but this has more of a table of contents as opposed to the 7 S's that we showed you before. And it has hopefully everything that's needed to use and operate with the Pfizer vaccination. Of course, throughout, as is in the other cases, there are clickable links throughout that Pfizer section. At the bottom are a number of different tools and resources to use. And of course, there are additional sections. So we hope that you enjoy exploring this playbook, and there will be updates added to it in the coming months. And so please consider a living document and come back. Thank you for viewing, and please reach out to us at Day Health Strategies if you have any questions.